back to AETV Live. This is still Health Talk with Ogaga Ekama, and I've still got Nurse Prince Isu, and we'll be tying the loose ends on this topic: vaginal delivery versus Caesarean section. She has told us what vaginal delivery is and also explained to us what the C-section is all about. Now, in the previous episode, I said I was going to bring in one or two myths that I've heard about.
Okay.
And because in this episode, we'll be looking at the recovery from the vaginal delivery and recovery from C-section, and also the advantages of both procedures. Now, one of the myths why I've heard ladies say, I'll have my children via C-section. A lady was telling me that, I will not say all ladies, that a couple of ladies that prefer C-section to vaginal delivery, because when we're having a conversation, I'm shocked that, and you also mentioned it, that, a lady, especially when she's not in health risk, she can just decide to have a C-section instead of the normal delivery. Yeah, and she was like, ladies that do that, some of them is because they believe that after having a couple of children via the vaginal delivery, the vagina becomes loose, and they might not be able to pleasure their partner when it doesn't have that grip as it used to before a couple of deliveries. How true is that?
Okay, so firstly, the vagina is an elastic organ, so it expands and returns.
Okay.
So during delivery, the baby comes through the vagina, and after some time, it recovers, because of course, as the baby comes out to the vagina, the head of the baby comes out to the vagina. The vagina doesn't just becomes as big as the head now. It retracts back, but over time, after one delivery, second delivery, third delivery, it doesn't remain the same exactly like a primigravida. So a primigravida is a term we use for a woman who is having her first pregnancy and first delivery.
Okay.
So when you see a primigravida and the vagina, you can able to know, this person is a primary, because you see that it's more tight, and everything. But after a woman has delivered 1 to 2 tries, as much as it comes back after delivery, it doesn't return back to the primigravida stage anymore. So that's why most of them will be like, I don't want it to get that.
So it's not a myth in itself. It's actually true.
Yeah, it's actually, we can say it's actually true, but it now depends on personal decisions, or if that's a rationale for wanting to not have it, or have it.
Then also, you also mentioned some of the complications that may arise. You mentioned in the vaginal delivery, you mentioned tear, and you said this tear can be done based on the discretion of the medical personnel, or accidentally, as the child is trying to come out, there is a tear. So in a situation where there is a tear, I want to believe that it will be stitched.
It will be repaired.
So when it is repaired, does it still heal back to the normal, or that is a permanent injury as well?
No, it's not a permanent injury. So that's why once a patient has an episiotomy, or
what's the
episiotomy is when we give the intentional cut to allow the baby pass, or the patient has a tear during delivery, like that just has a tear, we repair. It's called vaginal repair or cervical repair.
Okay.
So you're going to stitch it back, tightly, and so that it heals. So it's not like the injury is going to be there permanently.
So it heals, and during sexual intercourse with the partner, when after the healing, there's no pain.
No, there's no pain whatsoever. Of course, you don't have. That's why we're going to talk about recovery now. There's no. Once a woman delivers, you don't just have sex immediately. The whole place has to heal. Okay. So if she has an
just delve into the recovery.
So if she has an episiotomy, you have to give time for because it's an injury, it's a tear, so you stitch it and everything. You have to give time for it to heal and recover and go back to,
So now talking about recovery, so how long, when there is no tear, let's start from when there is no tear, how long does it take before for recovery, the recovery process? What's the duration, average duration?
For vaginal delivery, so I'd like to say this, that it's, as much as there's a time frame as per having a time frame, it's also
It varies. It's not
Personalized,
fixed.
yes, it varies. So it depends on the woman's body, her personal health history, and the whole complications that she went through delivery. So you cannot just determine that they said 2 to 4 weeks is the time. So for 4 weeks you are not recovered is a problem. So it's very personal. But the average of 2 to 4 weeks per vaginal delivery. So after 2 to 4 weeks, you're supposed to like feel a lot better. Feel a little better and start to transition into postpartum life. That's motherhood and all of that.
Okay. So still on this vaginal delivery. So what's the duration she needs to abstain from sexual intercourse with her partner? Is it 4 weeks is like a month?
Yeah.
So are you saying after a month she can now start indulging in sexual intercourse?
Like I said, I think it's still based on the woman's body and how far she heals. So we don't put a figure that after 4 weeks if you're not ready, there's a problem. So I think that men should give their wives grace. Yes, give her grace. Like allow her when she's ready, she would delve into it. But yeah, it's really based on the woman.
Okay.
I think for sexual intercourse is because we said 2 to 4 weeks is when you should recover from delivery. So she can't be able to start sex after 4 weeks. But it's also based on her. If she's not feeling up to it, her body still needs more time. She feels like she's not ready yet. I think you should give her more grace because she just had a baby, for crying out loud. So when she's good and fine.
Yeah, since we're still around the borders of sexual intercourse, now when there is a tear, it can be stitched, right? So if, like we talked about, after having a couple of children, the vagina does not have that grip as it used to.
Yeah.
So can it also be, without a tear, be stitched to make it a little bit tighter?
I've never heard of that though. Like, I get what you mean.
Do you get?
Yes.
So for persons that are really particular about
tightening.
Yes. Because even in this area, we've been hearing of different stuff to apply for vaginal tightening. So you can even see that. I don't know if it's pressure from the male gender or some female gender, just feel this internal pressure to do it to please their partner. So I'm saying if a stitch can work when there is a tear to tighten it.
You know that the tear were not okay, so you know that when we have the episiotomy, it's not like we're cutting the side of the vagina and the flesh just to allow space for the baby to come in. Then we're sewing it back to where it originally was. It's not like we're taking more and making it tighter. So we're taking it back to its original state. Okay. So there is no tying of the.
So doing that would be like encroaching into.
Yeah, I think that would be like gender mutilation.
All right. So now let's talk about the recovery from the C-section. We talked about the vaginal delivery, so the C-section.
Okay, so C-section is, and like I said again, it's really based on individuals. But the average is 4 to 6 weeks.
Oh, so the averagely and comparing both, the C-section takes longer time.
Definitely, because they had surgery, they had to heal. Yeah, that they had an incision. That incision has to heal, and their body just has to heal. So it takes a considerable longer amount of time for it to get back to normal.
So now we've shared with people, you have shared with people the downsides of or some complications that may arise from both procedures.
Yeah.
So what are the advantages of both procedures? So why should somebody consider vaginal delivery or why should somebody opt for the C-section?
Okay. So for vaginal delivery, one of the advantages would be shorter time of recovery, like we said. So you recover faster than somebody who had a C-section. Then secondly, lower risks of infection.
What does that mean?
Because if one of the complications of cesarean section is infection, because you're opening up the person.
Okay.
So you're opening up organs in the body that are not exposed to external environment. So putting that person can be a reason, even instrument, if there's anyone who's not properly sterilized or whatnot, it can cause an infection. But when you're having a vaginal delivery, you're like exempted from that. So in C-section, you have to do a lot of sterilization, make sure that it's aseptic, everywhere is clean, so that they don't allow the patient to have infection. But when you're having a vaginal delivery, you are exempted from that. So there's lower risks of infection. Then I think fourthly, there's better contraction, in the sense that after pushing the baby, not the womb or the uterus correctly, but the womb has to go back to like
It's original
position.
shape.
Yeah, so it contracts back. So because you had vaginal delivery, the normal natural course, after you push the baby out, it takes some time, the womb begins to contract back. But in C-section, it takes a longer time because you had an incision. So the baby, that all those push and all of that didn't happen. So for vaginal delivery, you have better contraction. So that's one of the advantages. So for cesarean section, the advantage of cesarean section is that there is reduced risk of perineal tear, cervical tear, all of those things they said. You can't have that because no episiotomy, no whatnot, because you did not have a vaginal delivery. Then also it is life-saving in emergency situations. Then also a more controlled method of delivery. So if you're going to have a C-section, you can try to say, "Oh, I'll have a baby on this day."
But say, if you want
If
to
I have a C-section, it's a more controlled environment of delivery. You can even, I think, for example, you don't say that, "Oh, I'll have my C-section on this day," like you book now, that kind of a thing. So it's a more controlled environment. You know you're going to deliver this day. Like vaginal delivery that can meet you, on our way anywhere. But for cesarean section, the more controlled method of delivery. Then another advantage of vaginal delivery that I didn't put is, and most women, that's why they go for vaginal delivery, is that there is no scar. There's no incision scar that the person with a C-section would have. So I think those are the advantages, and many more, of course.
All right, thank you very much, Nurse Praise Izu. But before I let you go, what would be your last words to that viewer, be it male or female, watching this and has gotten this knowledge on vaginal delivery and the C-section?
Okay, I think it's my favorite part actually. So my advice to the viewers and to everybody is that cesarean section is not an evil procedure. Cesarean section is actually a procedure that helps to save a lot of women from conditions that, if they had had a vaginal delivery, could have killed them. So if in a situation, yes, we all want to have the vaginal delivery, the normal natural course of delivery, the normal procedure. But if you have any medical condition, or your baby is at risk, and your obstetrician has gone through your medical history, your obstetric history, you've done your scan, and he recommends that you have a C-section so that we can have the goal, which is a safe delivery, you and your baby alive. I think as much as you can, you should go for it. In a good health facility with, results of success in their C-sections. So if your condition or circumstance from your history says that it's better you have a C-section, don't put yourself at risk even after they've told you to go have a vaginal delivery when you know that there's this condition there. So take the advice of a healthcare professional if they recommend it, and have you and your baby alive. Then also, because we're saying that cesarean section is not wrong, doesn't mean that cesarean section is absolute. Vaginal delivery is also beautiful. That is the natural course of delivery. That's how God created it to be. So as much as possible, if you're in good health, everything is good for you, still enjoy your vaginal delivery. So there's no one size fits all. It's very dependent on individual. Whatever your medical history is saying, whatever your scans are saying, just work with it. That's why it is good for you to go to a good health facility with good healthcare team, both the midwives, the nurses, the doctors, the obstetrician, all of them. Work with them, ask them questions, exactly, they're there for you. Ask your questions, let them guide you to make informed decision, and just choose the best one for you as far as you are alive and babies are alive.
All right, thank you very much, Nurse Praise Izu, who is a registered nurse and a midwife from the Asaba Specialist Hospital. Thank you for sharing your wealth of knowledge with us. And that's what we get to put the plugs on today's episode of Health Talk. It's been an amazing time. Please do it to subscribe to this channel and do it to share this video as well. It is I, Ogaga Ikama, thanking you so much for your time.